If you've been listening to Light 87 over the past month or so, you might have heard some clips by something called the Brave Project, which is essentially entreating you to go and get vaccinated. Now, the Brave Project was put together by a group called ADRA, and to tell us more about the overall project, which has since come to its conclusion, we've got Shenal from ADRA. Thank you so much, Shenal, for joining us today.
Thank you for having me.
Now, to start things off, can you tell us a bit about what ADRA is and what your work entails in general?
Sure. So ADRA is actually the humanitarian arm of the Seventh Adventist Church, and it's registered locally as a local NGO, but it's part of a global network that is present in over 118 countries around the world. And ADRA has been working in Sri Lanka since 1982 for almost 40 years now, and since the beginning, ADRA has been working towards uplifting lives of people across different districts. And right now we work in 7 districts of Sri Lanka, and our work mainly focuses on areas like water, sanitation and hygiene, health and nutrition, refugee reintegration, economic development, and also emergency response. So if I talk a little bit about what we do through all of these focus areas, in terms of water, sanitation and hygiene, we provide clean, potable water to people. It's a huge issue in estate and rural communities. A lot of people do not have access to clean water. So we work very closely with the National Water Supply and Drainage Board to provide clean water to people. And we also work towards improving the health, hygiene and sanitation of people in estate and rural communities through behavioral change. And we also work towards the improvement of health and nutrition by improving access to knowledge, healthcare and practices. And we also work in the north, specifically in Vaunia, Kilinochchi and Manal districts, with refugee returnees to help them reintegrate back to their communities. And we also support them by helping them establish livelihoods, which contributes towards the economic landscape of the country. And also, not just here in Sri Lanka, but around the world, the ADRA network responds to emergencies like disasters and like the COVID-19 pandemic. And we have pre-approved funding, resources, and trained personnel who can be deployed when a crisis or a disaster happens wherever in the world. So that's what ADRA does, and that's what ADRA is about.
Okay, so you actually mentioned ADRA's responses to crises, including the pandemic, and BRAVE specifically was in relation to the pandemic. Why did ADRA decide to launch the BRAVE project?
So the BRAVE project was initiated by ADRA to address the consequences of COVID-19 and to support the mitigation efforts of the health sector in Sri Lanka to curb the spread and the impact of the virus. When the COVID-19 pandemic broke out back in 2020, ADRA established a COVID-19 task force to implement 422 projects across 96 countries around the world to support at least 20 million people who were affected by the pandemic. And after that, we did not just do this by ourselves. We also partnered with different institutions, and especially we partnered with the Seventh-day Adventist Church, which also consists of different institutions like churches, schools, and a strong healthcare network, which consists of hospitals and clinics. So we partnered with these partners to support the people that were most affected by the pandemic. And when the second wave of the pandemic was making its way across the world, ADRA launched another series of projects to support people. While that was happening, we actually were conducting rapid assessments in the areas that we were working in. And we identified several needs and gaps that needed to be addressed. And these range from hygiene and sanitation to economic recovery, things like that. And what we did was we were looking for funding to start a project to address these needs, and that's when ADRA International intervened. And they provided the funding that we need to address the needs, and that's how the Brave project came about.
Okay. So on the topic of those needs, that's the next segment that I want to get into, is what were the specific goals of the Brave project? What were things identified, and then what were the steps taken?
So we wanted to achieve a few things through the Brave project. And the first thing was we wanted to reduce vaccine hesitancy and raise awareness about the importance of vaccination. A lot of people were hesitant to get the vaccine because of the misinformation and the myths surrounding it. And a lot of people that I personally know actually believe these myths. And a person that I met in the field actually told me that she initially refused to get the vaccine because she heard that a person died from it. She later on found out that it was a rumor, and she got herself vaccinated. So we wanted to raise awareness about vaccination. And the second thing was we wanted to establish resilient communities. So when the COVID-19 pandemic broke out in 2020, we were not prepared for it. It was abrupt, and it actually affected the country as a whole and us people and our well-being. So we realized the importance of being prepared for something like this in the future. And that's when we found out that it's not something we found out, but it's obvious that faith leaders actually are very influential people in communities. And people rely on them for information, and they rely on them for decision making. So since we realized that, we thought of partnering with faith leaders to address the misinformation that was surrounding the vaccine, and also to establish what we call an interfaith forum. So this forum consists of different faith leaders from different faith groups. And through that, we also identified young community leaders who were gathered to establish what we call the Interfaith Pandemic Resilience Team. So these two groups we wanted to train them so that they are better prepared to effectively respond to a situation like the COVID-19 pandemic in the future. So we wanted to support the mitigation efforts of the health sector. We identified certain gaps in terms of resources and infrastructure. So we wanted to help them out in terms of that. And we also wanted to contribute towards economic recovery, because a lot of small-scale businesses were hugely affected by the COVID-19 pandemic. So we wanted to support these small-scale businesses to restart their businesses and carry them out successfully. So those are the things that we wanted to achieve through the Brave project.
Okay, so then lofty goals. What were the outcomes of the Brave project? Now we have come to the conclusion of it. How well were you able to meet those goals and address those needs?
We actually, I think, since we have come to the end of the project, I think it's a good time to talk about the outcomes. So, like I said before, we established the Interfaith Forum and the Interfaith Pandemic Resilience Team. And we trained them on topics like pandemic resilience, psychological first aid, safety and self-health care. And now they're well prepared to face a similar situation in the future. And we also equipped the Interfaith Pandemic Resilience Team with the required knowledge to identify the needs in their communities and to write project proposals, to come up with budgets and fundraising campaigns so that when something like this happens in the future, they can effectively respond. So that is one of the outcomes of the project. So we were also able to raise awareness about the importance of vaccination among people, and we did this through different means. We used social media, we used IEC materials like posters and leaflets, and we also advertised on health messages on Light 87. So through these things, we tried to create awareness about the importance of vaccination among people to reduce vaccine hesitancy. So we were also able to support the curative and the preventive health sectors, and we supported several MOH offices in Minuangoda and Nigambo. So we also contributed towards economic recovery, like I said before. We identified several small-scale businesses, and we supported them by providing them trainings, and also by providing them the materials, the resources that they needed to restart their businesses. And we are also in the process of establishing an online platform, a learning platform, where people can get the core knowledge that they need to start a business. And we're doing this with the small scale enterprise division of the Ministry of Youth and Sports Affairs. Those were the outcomes that we were able to achieve. We provided access to vaccines, especially to people with disabilities. They could not get the vaccine due to challenges with mobility and whatnot. So we made sure that they got vaccinated as well. So those were the outcomes of the project, and that's what we were able to achieve through the project.
Okay, so now that the BRAVE project is done, what's next for ADRA?
So that's actually a good question because ADRA is actually going through a lot of transitions and changes, and we are in the process of restructuring ourselves. And we recently had several strategic planning meetings to discuss how we can move forward and how we can restructure ourselves to better address the current needs and the needs we foresee in the future in Sri Lanka. And we are also working towards expanding our scope of work and the areas that we focus in. We hope to focus on areas like climate action, economic recovery, food security, which are very timely at the moment. And whatever we do, we hope to serve communities better and also, bring about just and positive change.
Okay, so if people wanted to learn more about the future work that you have planned, also just in general, ADRA and the work that you're doing, where would they be able to find it?
We are on all social media channels, and we share what we do through our projects on our social media channels. And we also have a website. You can visit us at adrasrilanka.org. So you can learn more about what we do through all of these platforms.
All right, thanks so much, Shenal. And that is about the BRAVE project put together by ADRA. Thanks again for joining us.
Thank you for having me.